there are so many experts from so many different areas and backgrounds involved in this working group that one only has to learn from this working group. Being a young oncologist and the chair of the Young Oncologists Committee, I would like to start with its educational potential. In terms of education, the ESMO-MCBS provides this methodological and a validated approach for data interpretation. And I think it's especially valuable for oncologists in training. For example, when we discuss the added value of a new available therapy or a new approved therapy, or by using it in some cases in the clinical practice, when we discuss some clinical trials, for example, in the format of a journal club. Obviously, this educational part goes along with building guidelines that are part of our clinical practice on a daily basis, and we are an extremely important pillar of the clinical cancer care. The ESMO-MCBS is also extremely valuable when it comes to clinical decisions. On a daily basis, we need to explain the patients and also the family whether the therapy that we are proposing has or has not benefit. And I think this is extremely important because we are in some cases proposing therapies that are not reimbursed, and we need to explain it in a language that can be easily understood, and this can be done with this tool. I definitely recommend my colleagues to use this once they are in a position or in a role where they need to evaluate clinical trials or new therapies. I would like to reach out to the young oncologists that are starting their training and that need to put in context all the therapies that they are going to be using in their daily practice, to get familiar with this tool and to use it critically to evaluate the new therapies and see if they pass the ESMO-MCBS tool test.